welcome to the Sunday Healing ALS community meetings. Okay, this is week 14 of our 26-week course. And if you want to get caught up on past recordings, to get caught up on this course, basically you can go to HealingALS.org, click on PAL Support Webinars. You have to join as a member. It's free to join. And you click on webinars and you can find the past webinars to get caught up on a lot of the talks that we've had in the past. With this, we meet on Sundays, 12 p.m. Pacific, 3 p.m. Eastern, 9 p.m. European time, okay? This is for educational purposes only. We are not medical professionals and we're not here giving you medical advice. But what we're doing is letting those who have stopped their progression or either reversed their ALS, speak to those who are now dealing with their ALS and hope that they can find their own path and journey to their own improvement with ALS, okay? We've met over probably 40 pals by now with ALS, visiting them in their homes, talking with them, and seeing how they've done this. We are not here giving false hope. We're giving hope to those who are out there, and hopefully that they will be able to share with what they're doing with other pals so each pal can find that journey. Our goal is to have 100 reversals in this group, and we want to do that by 2022. And right now we're pretty much on track. People are gaining in functionality and they're doing great. I know that sounds incredible with a large number of people and reversals, but it is happening. I believe Dr. Bedlack may be up to close to 50 reversals that are documented now. I know he was in the mid-40s the last time I had a conversation. And so it's important that everyone stays positive as they do this and do your own research. Your own research is important to make sure there's something that resonates with you in your own healing, okay? Also, use your healthcare professionals, your medical professionals, everyone that you can in your own resources, but they are just advisors to you. You are the president of your own healing. That's very important. You want to be at least, I want to say, 50% physical and 50% mindful, but more that we're looking into this is more like 70-30 or 60-40, mostly mental and less physical, even if you are doing all of your regular physical regimen with your detox protocols that you have. Also, make sure that you understand this is a marathon. This is not a sprint. With some pals, it takes time to stop the progression of this disease and reverse it. Others have done it fairly rapidly, but you do this at your pace and your individual journey, all right? Have fun while you're doing this. It's very important that you stay positive because having a positive mental attitude helps you to absorb nutrients and everything with your individual body, okay? And everyone is different. What resonates with you and what has worked for another pal may not work for you, but with the variety of information we have from pals, you can find your own journey and go with your path to healing. Today is a wonderful day. We have Dr. Ashish Patel is going to be talking, and Tish, can you go ahead and introduce Dr. Patel?
Yeah, so actually I've got one more little thing to do first. One of them is the newsletter that you got yesterday, and actually the reminder today, although it went out late, has an article from Dr. McCullough about healing with the mind and how your thoughts and your mind and your emotions and stress affect your body. So if you haven't read that, go take a look at your email, and everyone in here should be on the email list. And one other thing, just a couple of little homeworks. You need to whitelist info@healingals.org, info@healingadvocates.org, and healingals@gmail.com. I've been experimenting a little, and I seem to be getting more from the Gmail. Not everybody, it's going into their promotions, and you can say everything but from healingals.org should go into my inbox instead of my promotions. But that's up to you. And if you don't know how to do that, it is online on how to do that. There are YouTube videos on how to do that. So also, before we get started, Are you finding this class helpful? We have over 200 cases of ALS worldwide, over 330,000 in the United States, 200,000 worldwide. So just in the past 2 years, we have over 10,000 cases of ALS diagnosed in the past 2 years alone. We're getting between, generally we're getting around 200 people each week. Our most that we've gotten is over 300 for Tabata's. So the social media makes a lot of difference. The reason that we did, Tabata had almost 300 people, was that she did a lot of social media beforehand. So I think if every single person on this call, if the 200 of you or so that are going to be physically on this call today, please share the Sunday meetings. If you're finding benefit from it, please share it with your friends. If you're a veteran, share it on the veterans. If you're a woman, share it on the women's group. If you're a caregiver, share it on the caregivers groups. Become a member of, say, 3 Facebook groups, and you're all doing holistic research on your own. So, you read a great article from Mercola, or a wonderful article from Erica's Winning, or ALS Winners from Kim and Kay, or Stephen Shackle from shackle.org. Any article, any blog that you find helpful, share those. If you read a blog on HealingALS.org and you thought it was very helpful, share it in a few Facebook groups. Really engage in those Facebook groups, because people believe there is nothing you can do to heal. And every week we find more people that are reversing ALS. And they're noticing, they're feeling better, they're getting more energy, they're starting to get little movements in their hands, and they can move their feet a little more. I mean, it's a start. And every full reversal that's now 95% reverse all started with a little movement in the fingers, a little improvement in energy, a little improvement in swallowing. This is how it starts. So every single one of you, I believe very strongly, can reverse ALS. That's why you're here. So please become a member of a few Facebook groups, and just share an article a week on holistic medicine so we can start changing the paradigm. We're getting more and more neurologists asking us about what people are doing every week as well. The neurologists are starting to come to us, and so you need to go to the pals and share with your neurologist and share with the pals. Anyway, I'm actually going to have Smita talk about, she's a medical doctor, and she will be introducing Dr. Patel, because he is here, thankfully, because of her. And it's really cool that Ayurvedic medicine can start reversing symptoms of ALS. Her husband Vivek was diagnosed in 2019, and they have a medical family. Actually, as of next year, they're going to have 4 official MDs in the family. So Vivek is an orthopedic surgeon, Smita a gynecologist, and their 2 sons, one is a first-year medical student and the other is in a final year of medical school. So this is so exciting. What I'm excited about is Smita and Vivek just started. They've been using functional medicine therapies for a couple of months, and they're starting to know just little tiny things, and that's where it starts. Little tiny bit of energy, little tiny bit of movement, little tiny improvements. That's exactly how a reversal starts. So, and just for those of you who don't know that what our Healing ALS mission is, it's right on our homepage. And the second, if you'll read the second one, I put this: change standard of care for all ALS patients to include nutritional testing, gut and liver function testing, toxin testing, as well as appropriate treatment to correct these. This is why we're here. This is why you guys are here, and this is why we're doing this every Sunday. Okay, it's a lot of work to do this every Sunday. So I think, and we really appreciate the work that Dr. Patel put in and Smita put in. So Smita, go ahead and introduce our speaker for today.
Hi, Dr. Smita Jain. I'm the consultant gynecologist from UK, and I have joined this group, fantastic group, since it started, since week 1. And I would like to introduce Dr. Patel today, who will be speaking to us on ALS and the management of ALS in Ayurveda. And Dr. Patel, he is an MD. I'm just going to give a short introduction. He did his BAMS from Indore, where I come from, which is the central part of India, in 2011. Then he did his MD in Ayurveda from BHU, which is a very big university in Varanasi, in 2015, which is a specialty in the neurological disorder and neuropsychiatry. He also did a diploma in yoga from BHU in 2014. He was ex-assistant professor in a government Ayurvedic college at Riva in one of the counties in India between 2016 to 2017. And currently he's working as a government Ayurvedic medical officer in a place called Sagar in central part of India, which is near 3 hours from Bhopal. His wife, Dr. Kirti Patel, she's also an Ayurvedic doctor, and she also did her BAMS from Bhopal in 2010. Then she did her MD from Pune in 2012. She had a specialty in Panchakarma, skin disorders and gynecological disorders. She was an ex-assistant professor from RD Memorial PG Ayurvedic College, Bhopal between 2012 and 2016. And currently she's also working as an Ayurvedic medical officer in Sagar since 2016. So welcome Dr. Ashish Patel and Dr. Kirti Patel. And he will be now speaking to us regarding ALS management and the approach in Ayurveda. Thank you.
Thank you, ma'am. Hello.
And Dr. Patel, just welcome for being up in the middle of the night.
Okay, thank you.
Really, really appreciate it. What time is it now there?
I think
it's around 1 a.m. anyway.
Yes, yeah, 1 a.m. right.
So go ahead, Dr. Patel.
Hello, namaste to all of you. I am Dr. Ashish Patel, MD Ayurveda. My specialty to treat neurological disease and neuropsychiatric diseases through Ayurveda. Presently, I am working as a Ayurvedic medical officer in India. First of all, I would like to great thanks to Dr. Smita ma'am, Patricia and Scott for giving such great opportunity to me to present a Ayurvedic webinar in front of Healing ALS committee. Now we start the webinar. Today's topic is approach of Ayurveda in the management of ALS. Next slide. Now a question is arise, can Ayurveda fulfill this requirement? So yes, because several recent studies included those present in recently held 13th annual meeting of Indian Academy Neurosciences suggested that Ayurveda may indeed provide good holistic care and treatment, provided we understand rationally behind the different Ayurvedic formulation and their uses. Next slide. What is Ayurveda? So Ayurveda is the ancient holistic of India. The fundamental aim of Ayurveda therapy is restore the balance between three humors or dosa like Vata, Pitta and Kapha, and also coordinate the body, mind and consciousness. These three those are responsible for maintenance of homeostasis in the body. If the equilibrium of these three dosa is called good health, if disturbance of these three dosa called disease. In generalized term, nervous system is related to Vata dosa, and endocrine system is related to Pitta dosa, and immune system is related to Kapha dosa. We can see in picture Vata presently properly related to air, Pitta property is related to fire, and Kapha property is related to water. Next. Next slide, please. Now discuss the concept of neurological disorder in Ayurveda. Generally, Ayurveda has been treating neurological disease since its inception. Neurological problem in Ayurveda described mainly in context of Vata Vyadhi. Vata Vyadhi means the disease caused by Vata dosa. Ayurveda considers neurological disorder to be result of bath disorder. Ayurvedic treatment for neurological disorder will aim to rectify bath imbalance, bring the bath dosha in harmony with pitta and kapha dosha so as to eliminate the disease. Next slide. Now question is arise, what is bath? So bath is a bioelement which is responsible for all movement of the body. Bath regulates sensory motor function in the body, and balance of bath regulate all neurological connection like neuromuscular, neuronal, neurological, and neuroglandular. Next slide. So discussion of bath. Bath have 5 types which have a specific location in the body and its specific function. So the type of bath is 5 is Pran Vatha, Udan Vatha, Vayan Vatha, Saman Vatha, and Apan Vatha. First is Pran Vatha is located in head and neck region, and its function is intellectual function, all function of sense organs, psychological activity, and reflex activity like sneezing, belching, and deglutition. Udan Vatha. Udan Vatha is located in throat, chest, and nose region, and its important function is speech. Third is Bhyan Vata, which is located in head and entire body. The function is circulation of blood and control the sympathetic and parasympathetic system and all motor function. Fourth one is Saman Vata. Saman Vata is located in stomach and intestine region, and its function is reception of food, digestion of food, and division of useful and waste of food. Fifth one is Apan Vata. Apan Vata is located in uterus, urinary, and rectum region, and this function is micturition, ejaculation, defecation, menstruation, and perspiration. Next slide. Now the classification of bath disorder. So bath disorder have many types, but pathology of bath disorder is 2 types. First is due to obstruction of bath, and second one is due to degeneration of bath dosha. Next. Now what is ALS according to Ayurveda? ALS, it is a disease of nerve cell in the brain and spinal cord that control voluntary movement. We all know. Now, according to Ayurveda, MND ALS is a degenerative disease of affecting brain due to deviation of a bath dosha. So pathology is when bath dosha obstructed by kapha dosha or pitta dosha, then bath is vitiated and causing these symptoms like reduced activity, weakness, and spasm in the body. Next. In Ayurveda, so many bath disorder described, but the following condition can be included under these disease because the symptom of this condition is very related to ALS symptom. First is Sarvan Vata, means vitiated bath spread to whole body, causing severe pain in all body, like bone, muscles, and joints. Second condition is Budgat bath, means vitiated bath spread to anus region, that causing constipation, difficulty in micturition, and severe pain in anal region and both legs. Third condition is Tokagat bath, means the vitiated bath spread to skin, which causes dryness, cracking, numbness, black discoloration of skin, pricking pain in skin, pain in joints. Next. Fourth condition is Raktagat bath, when vitiated bath spread to blood circulation, which causing acute pain, burning sensation, discoloration of skin, anorexia, appearance of rashes on the body, stiffness of the body after taking food. Now, fifth condition is Mas Medugat Vatha, means the vitiated bath spread to muscles and fatty region, which cause heaviness in the body, severe pain in muscles, weakness, and lethargy. And last is Asti Majjagat bath. This condition, vitiated bath is spread to bony region and cause cracking of bone and joints, wasting of muscles, loss of muscle strength, and constant pain. Next slide. Now, management of ALS through Ayurveda. The whole management can be categorized following manner. First is oral intervention by herbal or herbomineral classification Ayurvedic preparation. And second is Panchkam therapy. Panchkam therapy is a detoxification therapy, detoxification of the body. Generally, all Ayurvedic drugs derived from plants. Some drugs prepared with combination plant and mineral, so it is very safe and not cause any side effect of taking a long time. Now, first is herbal and herbomineral drugs. In ALS, those drugs are used which have following property. First is Brahan property, means which nursing the body. Second one is Rasayan property, means the rejuvenating property. And third is Anuloman drugs, and which has purgative property. And fourth one is bath herb medicine, means the which drugs use cause balance the bath dosa. Next slide. So now first is Brahman, means nourishing of the body. So its goal is with the control the symptom and help you to maintain good quality of life. There is some herbs. Next slide. Brahan medicine goal is control the symptom and help to maintain a quality of life. There is some herbs which indicate for the Brahan kan like Ashwagandha, Vala, ghee and Silajit. Next, describe next slide.
Yeah, so I wanted you to all notice as Dr. Patel is speaking, a lot of these are available in the US and are used, many of our ALS reversals, as you're going through these herbs that he's discussing, these Ayurvedic herbs. Like ashwagandha is one example that a lot of pals have really noticed an improvement when they started taking it. So ghee is another one. So just as Dr. Patel is going through this, watch what he's doing. The other reason why his talk is so important is almost every large city in the United States has Ayurvedic doctors. There are some really good, and most countries actually around the world have good Ayurvedic doctors available. So I just wanted to let you know, practitioners available. So just, you know, that's why we're doing this, because we have, people have shown some improvement with Ayurvedic medicine for ALS. Go ahead, Dr. Patel.
Next. Now, the Ashwagandha and Vala drugs widely used in the medicine of neurological disorder. First is Ashwagandha. The botanical name of Ashwagandha is Bethania somnifera. It has property of anti-inflammatory, antioxidant, anti-stress, immunomodulator, homeopathic, hemopoietic, and rejuvenating property. It also positive influence on endocrine, cardiopulmonary, and central nervous system. It is purely plant medicine. Second is Bala. The botanical name is Sida cordifolia. It has property of anti-inflammatory, psychostimulant, reduced chest congestion, effective in nervous and urinary system, and aphrodisiac and cardiotonic property. Next. Now, second is Rasayan medicine, rejuvenating property medicine. This is cause lengthening of lifespan, improve immunity, or nourishing the body. So many drugs like Ashwagandha, Chyawanprash, Silajit, Guruchi, etc. are used as a Rasayan property. Then they can take in every day in morning, empty stomach. And third is Anuloman purgative drugs, which Anuloman substance which digest the undigested food of the body. After digestion, it simplifies the digested waste product, help in easy expulsion of digestive, and simplify stool by relaxing of anal sphincters. Next, please. Now is Panchkam therapy, means detoxification method. It is a detoxification method is very important method to treat bath dosa as well as neurological disorder. Mainly it have 5 types, but following 3 methods is very useful in case of ALS. Then first is Isnehan, means oilation of the body. It is two type, or externally or internal oilation. In internal oilation, which use like milk, ghee, muscle fat, bone marrow are administered. Example, milk, meat soup, payasam, means kheer, is made by rice and milk. And fourth one is Krishna. It is a dish which is made by pulse and rice and ghee. For external massage done by medicated oil for external oilation. And second therapy is Sweden therapy.
Can everyone hear and see that now?
Yes, I can see it now.
So this is just 4 minutes. When I saw this, I was a little overwhelmed, but I think, Smita, I wanted you to, maybe afterwards you can tell people that you actually do some of these processes at home with your husband. So I think.
Place your bottle of oil in hot water for 5 minutes. Pour the warm oil into your hand and rub them together. Start with your scalp using fingertips to work the oil in well. Use small circular movements along your face and ears. Massage your neck, collarbone and shoulders with wide circular movements. Use long strokes on your arms. Pay special attention to the joints. Use circular movements over the joints and around them. Legs in downward direction. Again circular on knees and ankles. Massage your upper body with circular moves using gentle pressure. Also belly, buttocks, hips, thighs and lower back in same manner.
Means hot fermentation, in which medicated hot bath with bath herb medicine, which reduce the vitreous of bath. So it has so many types. Now Nadi Sweden means steam bath and second is cystic Salipinda Sweth. These are very important in the case of ALS. Now, next slide, we describe the cystic Salipinda Sweth. It is a specific type of fermentation. The heated medicinal rice pudding which have been cooked with Ayurveda herb are applied in the form of bolus tied up a cotton cloth. The bundles are constantly reheated in decoction of herb and cow milk. It is very useful in chronic bath disease, insomnia, multiple sclerosis, paralysis, muscles weakness, or muscle stiffness, other degenerative conditions. It can done in as a rejuvenation and anti-aging treatment for a healthy person.
So Dr. Patel, perhaps you can let us know what's happening right now since there's just music.
It is a steam bath video in which medicated bath drugs are used after oilation of the body and given steam bath. And due to steam, the medicinal oil penetrate in the body and give your maximum result.
Yeah.
In which all part of the body is give steam from toe to head. I always close with cold cotton because not steam in eyes.
And you can use a pressure cooker as well and connect it to the tube, and the medicated oil or decoction is in the
decoction.
So this is used so that you can get further into the skin than you can with, for example, the diffusers?
Maybe. Yeah.
Dr. Patel, what is the temperature of the steam as it's applied to the skin?
First, try in a small part of steam. When patient is tolerable, then he steam.
And it should not be very close to the skin. If you go a bit further away and whatever the patient can tolerate. Dr. Patel, can you discuss about Basti video, Basti Panchakarma?
Now, last third is Basti, means in which medicated enema. In which there are two types. First is Niruvasti, means the enema of medicine decoction. The second one is Anuvasan Vasti, in which enema of medicated oil is given. These preparations are made by Bathar medicine like Bala, Rasna, Dasmul, Aswanda, Aran. All these are herbal drugs, and its administration for 15 days in 3-month cycle. It is very important therapy for bath disorder to balance and rectify the bath dosa, because the specific location of bath is lower intestinal region. So the locally drugs are introduced through anesthesia by Basti method.
Important procedure among Panchakarma in which the medicines in suspension form is directly administered to the lower gastrointestinal tract, urinary tract or genital tract with the help of an instrument called Vasti Yantra after Snehanam and Swedanam. Initially, Makshikam is poured in the Khalva Yantram and powdered Saindavam is added gradually and triturated properly in a clockwise direction to ensure a homogeneous mixture. It is followed by the mixing of appropriate thylam in required quantity slowly by the side of the mortar and stirred continuously until it attains a uniform consistency. The kalkam, which is a fine paste of drugs, is added in small quantities while grinding with the pestle is going on. Then the kwatham, in required amount as per yoga, is added and properly mixed. The mixture is filtered through a fine sieve and finally made lukewarm by keeping it over a hot water bath. When it is lukewarm, sukokshna, and comfortable for the patient, it is then transferred to a specially prepared plastic cover, Vasti Pudagam, having sufficient thickness, and then Vasti Netra is placed dipping up to the first Karnika so it can be tied well, keeping it in position. The other tip of the nozzle will be plugged with cotton to avoid filling of air inside. Before giving Vasti, local Snehanam and Swedanam are applied. The patient is made to lie in the left lateral position. The anus is lubricated with suitable oil. The Vasti Netra is slowly and gently introduced into the anus. The patient is asked to inhale deep with his or her mouth open. Vasti Dravyam is gently and uniformly pressed into the rectum until little material is left inside the Vasti Pudagam. The Vasti Netram is gently withdrawn from the anus and the patient is allowed to relax in supine position. Slow, gentle and circular massage is to be given on the abdomen for a few minutes till the patient feels the urge for defecation. Usually, the patient is advised to retain the Vasti Dravyam for 5 to 15 minutes. After proper defecation, Laghu Annam is administered.
Udvartanam is a deep tissue and dry massage using herbal powders. This massage stimulates hair follicles and fat tissue to break down fat storage. The treatment involves upward stroking where the powder is rubbed with gentle force on the body. Udvartanam reduces blood cholesterol, obesity, skin problems, imparts mobility to the joints, strengthens muscles, and refreshes the body. This treatment softens and exfoliates the skin, improves muscle tone, and is a favored treatment for those with sensitive skin.
These are some authentic and registered Ayurvedic pharmacy company of India. Dut Officer, Kotakkal, Himalaya, ML Pharma, Alaknanda, Ayurveda. If anybody is interested, they should be buy from these authentic sites. Next. Now we can discuss two case presents in front of me, which treated with Ayurveda and they get good improvement. We now discuss the first case, a patient who was diagnosed with ALS. His age 75, male. He was a retired Indian Army. Presented to doctor with history of weakness in both upper and lower legs, fasciculation in forearm. He also had difficulty in speech and regular activity like buttoning of clothes, removing of pen caps, walking, and reduced gripping. Sign present is slurred speech, wasting of arms and legs muscles, and fasciculation. Its ALS FRS score before treatment is 20. On examination, CNS examination, alert and responding to commands, higher function is normal, speech is slurred, sensory effects like touch, pain, hot, cold is normal, and power of muscles in left arm and right arm is reduced. The score is 1 by 5, and the left leg and right leg power of muscles is normal. Fasciculation were found in both upper arm. Wasting was present in both shoulder, arm, and hand muscles. And other hematological chemical, thyroid profile, and serum calcium report were normal. He were given following treatment. First is herbal intervention from orally. It is Ajmodadi powder. Give 5 gram twice a day with lukewarm water for 5 days. Next 15 days, give herbal ashwagandha rest with 20 ml twice a day. Add equal amount of water for 15 days. Next 1 month, give Ras Rajeshwar Ras and nursing powder. Ras Rajeshwar Ras is a herbomineral compound which give 250 milligram twice a day, normally water with room temperature for 1 month. And second is herbal powder nursing churn. Give 5 gram twice a day with lukewarm water for 1 month. Is Panchkam intervention, is detoxification method, in which give 4 stage. First 5 day give Udvartan, with means the massage with dry herbal powder given ashwagandha and sunti churn for 5 days. Then 15 day give 3 method. Sarvang Abhyang means massage of oil in whole body. Second steam bath and Vaspshed. Third Mastavasti means oil enema. The Sarvang Abhyang given by Mahanarayan oil. The steam bath given by Dasmuli decoction. And Matravasti given by Mahanarayan oil 50 ml. These given for 15 days. And third stage give Nas. This means the medicated oil given through nostril, in which use Chirwala oil for 10 days. And second is Sasti Sali Sweet. We can also see the video of Sasti Sali Sweet. I describe it is made up by rice, cow milk, and decoction of Balamula, in which I describe the heated medicinal rice pudding which have been cooked with Ayurvedic herb are applied in the form of bolus tied up in a cotton cloth. The bundle are constantly reheated in decoction of herb and cow milk. It is very useful for chronic vata, insomnia, multiple sclerosis, paralysis, muscle weakness. The second case, he was a 45-year-old male, 2-year history of speech difficulty, weakness in upper and lower limb, wasting, spasticity and tremor, mood and sleep disturbance, and breathing difficulty. Before treatment, its ALS FSR score is 17. Next, he was given a treatment. Follow next slide.
This one, do you have it?
He was given treatment following first oral treatment. For first 5 days, give Panchkol decoction 20 ml twice a day after food with water, and Mahanarayan Kalyana Ghirath 10 ml twice a day before food with lukewarm water. And then next 15 days, give Chirwala capsule, 2 capsules twice a day before food with water, and Kalyan Aule powder churn means give 5 grams twice a day after food with honey. And third is Aja Asugandhi Leham. It gives 10 grams twice a day after food with water. Next is Panchkam detoxification method given for first 5 days Udvartan.
Shashtika Pinda Swedam is performed in Ekangam or Sarvangam with a bolus of boiled Shashtika rice cooked in Balamula Khwatam and Shiram. Though a Sweda Karmam, it has Brahmana Gunam. Initially, Balamula Khwata is prepared with 750 grams of Balamula, which is cleaned, crushed and boiled in 12 liters of water and reduced to 3 liters. After that, 500 grams of Shashtika rice is cooked in 1.5 liters of Balamula Kashayam and 1.5 liters of milk, boiled till it becomes thick and semi-solid. Sufficient quantity of hot water can be used for proper cooking of the rice. The cooked rice is then divided into 4 equal parts and put into 4 pieces of cotton cloths. The 3 corners are folded neatly together, and the 4th fold is used to cover the other 3 corner folds underneath. One end of the thread is held tight with the left hand and the other end is wound around the folds. In short, the boluses should be tied in such a way that the mouth of the sac leaves a tuft at the top of the bundle for holding it with ease. Conventionally, the size of a bundle is half kernel of a moderate coconut. The patient is then seated over the droni and applies shirotailam over the head, ears and feet. Then perform abhyanga with prescribed oil for about 10 minutes. Out of 4 potlis, 2 are immersed in the boiling mixture of balamula kvata and milk on the stove with moderate heat. 2 warm potlis should be gently applied in a synchronized manner by the 2 therapists on the 2 sides of the droni. It is followed by a gentle massage with the other hand. They should ensure that the heat of the boluses is bearable to the patient by touching them over the dorsum of their hand. The temperature of the boluses should be maintained throughout the procedure by continuous relay of the 4 boluses after reheating by dipping in milk kvata mixture. The process should be continued till the patient gets samyak svinna lakshana or until the contents of the boluses are exhausted. This procedure is done in the 7 positions as in Abhyangam or as advised by the physician. Normal duration of this procedure is 45 minutes to 1 hour. The preferable time is in between 7 to 11 a.m. and 4 to 6 p.m. The procedure can be stopped if the medicine in the boluses or the milk mixture is exhausted. At the end of the procedure, the medicine remained over the body should be scraped off with the coconut leaves or with any similar device, and the body is wiped dry with tissue paper or soft towels. After that, the medicated oil should be applied on the body. Talam should be removed and Rasnadi Churnam applied over the head. The patient should take complete rest for at least half an hour, and then the patient is allowed to take warm water bath.
Now the result in first case, the total duration of treatment given was 45 days. The pre-treatment ALS FRS score is 20. Now the time of discharge, it improved up to 25. It showed good improvement in speech, holding object, barking and generalized weakness. His gait improved as well. He felt energetic. The spasticity of the both upper and lower limb decreased. Overall improvement in his general condition. In second case, total duration of treatment is 55 days. Pre-treatment ALS FRS score is 70, and time of discharge is up to improve up to 29. The speech, access to salivation, deglutition, ability to walk, and shortness of breath showed good improvement, and no change in fine movement, tremor, and fasciculation. Next.
Okay, fantastic. This is very impressive. So
now last of conclusion of this webinar is the Ayurveda considered neurological disorder are a result of both those disorders. The recent advancement of Ayurvedic clinical research show that many incurable neurological problems can be successfully treated by Ayurveda medicine and Panchkarma therapy.
We are open to questions.
Thank you so much. I mean, this is very helpful. This, it's interesting because when you look at Ayurvedic medicine from India, Chinese medicine, and Japanese also has a whole holistic. We know of one ALS reversal case from Japanese herbal medicine, which is similar to China, but they use different herbs. And functional medicine, you'll notice they use a lot of the same methodologies that we use in functional medicine. So I think this is absolutely fantastic. So thank you very much. Really, really appreciate it. And I am going to actually unmute Julie and Marcel. And also go ahead, Smita, you're already unmuted. So you can go ahead and start with the first question, and then they will help choose the questions and you can translate then. Dr. Patel, thank you very much. So just to make sure he understands the questions fully, Smita's going to translate.
Yeah. Thank you very much, Dr. Patel. It was a very interesting and a very lovely talk today. There are questions now. So,
well, before we get started with questions, I do have one just off the top. Okay, Smita? And Dr. Patel, thank you very much for being here, Dr. Patel. That was very eye-opening. Now, with all of those ALSFR scores that had improvement, did you use the same protocol for each, or did you vary the protocol depending on which patient you had?
It was different.
It was different. Okay.
There was a question on ghee, but I think it has also been explained already, answered in the, let's say, in the chat itself. But ghee, to be sure, it's butter.
Yeah, I can tell you it's very easy to make. The ghee can be made at home. If you get unsalted butter and bring it to a boil one, and then just off it, and then it turns into ghee. Okay. That can be consumed. And yeah, that is ghee. Is a clarified butter.
Okay. There's another question. It was actually on the massage, which was also shown in a video, but in an early video. What kind of oil was used? It was a question from Vera.
Dr. Patel? Yeah.
Medicated
yeah.
oil कौन से आते हैं ये पूछ रहे हैं ना सर?
हाँ. कौन से medicated?
So many, बहुत सारे मैडम आप बता दीजिएगा, कई प्रकार के आते हैं जिसमें अश्वगंधा वेस्ट, बला वेस्ट, एरंड वेस्ट, जो हर ड्रग्स हैं.
There are lots of medicated oil which can be given to a patient, or massage can be done.
अपन ने महानारायण ऑयल से यूज किया जिसमें सभी बात हर औषधि.
Okay, and Mahanarayan oil was used and it is easily available online. ठीक है डॉक्टर पटेल? ये मिल जाता है ना? ये
मिल जाता है.
Yeah, you can get it.
Yeah. Smita, could you possibly type in this name possibly in the chat?
Yeah.
Okay, thank you.
I also just typed it in too.
Ah, perfect. Thank you. Thank you.
It's up. It's like 3 chats in.
Okay, perfect.
So Julie, you want to ask the next question? Whoever comes up with the question first, just go ahead and ask the one.
You can go, Marcel, because you're kind of keeping track.
Yeah, Robert asked, but then I think it was with the Sweden Pinda. Is the rice pudding fermented applied? But I'm not sure if I understand the question. It's from Robert.
Could you just read the question?
Yeah, is the rice pudding fermentation applied?
Yes.
It's fermented.
Yes, it is. It is like it is a hot, and it's like a fermentation. Yeah, right.
And that was the procedure that was in the cloth that's rubbed over the body, that last video that we saw.
Okay.
Yeah,
Yeah, here an important one. to Dr. Patel. Are there any classification or qualifications we should look for in seeking an Ayurvedic doctor? So how can we separate the good from the...
Great question.
वो पूछ रहे हैं कि हम कैसे पता करें कि ये अच्छे आयुर्वेदिक डॉक्टर हैं, क्या डिग्री से या किस चीज से पता कर सकते हैं?
जनरली पीपल तो नहीं कह सकते कि कैसे, मुझे तो रिजल्ट जब आप ट्रीटमेंट देंगे उसके रिजल्ट के बाद मालूम पड़ेगा, लेकिन बट क्वालिफिकेशन एंड किस इंस्टीट्यूट से पढ़े हुए हैं, कहाँ से पढ़े हुए हैं, ड्रग्स के बारे में कितना जानते हैं, रिसर्च पेपर और सब इस प्रकार।
He's saying that Kirti, you want to say something?
Yes, ma'am.
Yes.
Actually, जो ये आयुर्वेदिक जैसे कि अभी है ना, वर्ल्ड वाइज लोग इसको पहले जो पुराने वैद्य होते थे है ना, वो होता था, लेकिन अभी क्या होता है मैम, क्वालिफिकेशन बहुत ही मैटर करती है इसमें। जो अभी बहुत ही अच्छे क्वालिफाइड डॉक्टर्स अच्छी यूनिवर्सिटीज हैं जो कि एजुकेशन प्रोवाइड करती है इसके लिए, जैसे कि अभी है ना, तो एन एक्सपीरियंस है ना, वो भी मैटर करता है काफी सारा। तो किस सब्जेक्ट से वो डॉक्टर मतलब एमडी है, तो एमडी ये तो ऑब्वियस सी बात है कि एजुकेशन क्वालिफिकेशन मैटर करेगी इसमें, है ना, और फिर उसका प्रैक्टिस डॉक्टर का कैसा चल रहा है।
Yeah, she said that educational qualifications are very important, and as well as experience, how long they have been practicing and which university they have done from their MD. These three things are
important. Okay. Another question here. Can Ayurvedic treatment be combined with homeopathic treatment to treat ALS? It's a question from Varen.
वो बोल रहे हैं आयुर्वेदिक और होम्योपैथिक दोनों ट्रीटमेंट एक साथ दे सकते हैं क्या? Can they be given together, Dr. Patel?
जनरली होम्योपैथी के साथ तो मैंने नहीं किया है, लेकिन एलोपैथ में जो रिलीजुअल चल रहा है उसके साथ ट्रीटमेंट कंटिन्यू किया जा सकता है। तो होम्योपैथी के साथ जनरली हमने एक साथ नहीं किया हुआ है, क्योंकि द बेसिक ऑफ होम्योपैथी एंड आयुर्वेदा इज डिफरेंट। आयुर्वेद में क्या होता है कि रोग को कम किया जाता है, लेकिन होम्योपैथी का बेस ये है कि पहले रोग को इतना बढ़ा दो कि पीक तक पहुंच जाए, फिर वो अपने आप ही रिड्यूस होता है। तो हो ना सकता हो कि अपोजिट ना ट्रीटमेंट हो जाए। होम्योपैथी के साथ कभी ट्रीट नहीं किया है।
वो he's saying that normally homeopathy and Ayurvedic should not be mixed because the base of both the treatments are different. In homeopathic, they would like to increase the disease to certain level and then it reduces, while in Ayurveda it is completely different. So ideally both should not be mixed.
Okay, that's a clear answer.
Yeah.
Okay. Susan asks, do you need to be careful with heavy metals in the products? Heavy metals in products. I'm not sure if she means the products of the Ayurvedic or the...
Yes,
I think the herbs.
There is an issue. The herbs can have heavy metals in it, so the source is so important.
Yes, वो पूछ रहे हैं कि आयुर्वेदिक मेडिसिन में भी heavy metals use करते हैं, तो हमें precaution लेनी चाहिए क्या? वो heavy metals वो तो नहीं होता है, खराब तो नहीं।
एक्चुअली ये बहुत ही कॉमन क्वेश्चन है मैम जो पूछा जाता है आयुर्वेदिक प्रैक्टिशनर से। इसमें क्या होता है कि जो अच्छी कंपनीज हैं जो कि जीएमपी को फॉलो करती हैं, गुड मैन्युफैक्चरिंग प्रैक्टिस को, तो वो जो मेटल्स से जो मेडिसिन प्रिपेयर करती हैं तो उनको पूरा जो उसके रूल्स रेगुलेशन है फॉलो करके बनाती है। तो इसके लिए सबसे अच्छा है कि आप अच्छी कंपनी को चूज करके ही ड्रग चूज करें। उस मेटल से, हैवी मेटल से कोई भी हार्म होने वाला नहीं है बॉडी में, बस कंपनी, हाँ, क्योंकि उसका प्यूरिफिकेशन मेथड जो है पूरा प्रॉपर जो बुक्स में दिया गया है उसके अनुसार ही करती हैं। तो
इस पे मैडम कई रिसर्च भी हुई है, टॉक्सिसिटी स्टडी की है, मैंने खुद की है एक हर्बल ड्रग पे विद हर्बोमिनरल ड्रग्स पे, एक्यूट और सो मेनी डिसीजों मैंने पे और कई एनिमल्स पे इसका ट्राई किया गया, एक्यूट स्टडी और क्रॉनिक स्टडी। ऐसा नहीं पाया जाता, क्योंकि प्योरली अगर प्यूरिफाई होता है इट वर्क फ्रॉम नैनो पार्टिकल। जनरली इसमें ऐसा नहीं देखा गया है। अगर प्रॉपर तरीके से बनी है, सही फार्मा का यूज कर रहे हैं, तो इसको लिया जा सकता है और इसमें कोई भी।
Dr. Patel is saying that the medicines are usually purified. The heavy metals are purified and then they are used. So, and if they are made by good companies, they follow the protocol and then they are not dangerous.
Hey, Smita,
Yeah.
can you ask him what he thinks of the company Banyan Botanicals
Okay.
for ordering?
Okay. Dr. Patel वो पूछ रहे हैं कौन सी अच्छी कंपनी से ऑर्डर करना चाहिए मेडिसिन्स देन?
मैंने लिस्ट में जो दी है उसमें धूत पापेश्वर, एमएल, हिमालय, कोटक्कल, ऊपर से डिक्रीजिंग ऑर्डर में ऊपर वाली जो भी प्रेफर करेंगे सबसे अच्छी.
Okay. He has given the order in the slides and it is like in a descending order. So the first one is the best company, which is Dupapeshwar, then Kottakkal, then Himalayan, Amil Pharma. So as you go down, the first one is the best, like the Dupapeshwar is the best, then Kottakkal, and as you go down, it is in decreasing order.
Right, and just take a screenshot of this, guys, so you have it.
Yeah. And if you order from these companies, they follow all the protocols and they are safe.
And they're Indian based then, I take it.
And they are all Indian based companies, right?
Okay.
That's a good question. There are companies that distribute them in the US, but again, I would talk to a US based Ayurvedic doctor to find that out. So if you do, that's a very good question. But a really good Ayurvedic doctor in the US would know. I would imagine most of these companies, my guess is they order them from India, right? When you order your Ayurvedic medicines from the UK, for the UK, Smita, do you order them from India?
Yes, we get it from India. Yes, we get it from India.
Okay. Karen asks, do patients ever get pranic healing? But I'm not sure what that means. Pranic, P-R-A-N-E.
Pranic healing.
Pranic healing.
Dr. Patel वो पूछ रहे हैं patients को pranic healing होती है क्या? ये मुझे भी नहीं मालूम. Can you explain? Pranic healing क्या होता है?
Pranic healing. आयुर्वेद में तो ये कोई जनरली डिस्क्राइब नहीं किया गया है प्राणिक हीलिंग का.
अच्छा अच्छा. He's saying this terminology is not described in Ayurveda. It may be something different.
Okay, yes. Then possibly, yes, Karen, if you could recheck and then possibly post it again. Okay. Do the herbs have English or scientific names? Because I think that question came up twice now.
Yeah. Herbs के scientific names हैं क्या? I think है ना, सब है scientific names.
सभी के हैं, सभी के scientific names.
We have scientific name for all the herbal medications, herbal plants. Yeah.
Botanical name.
Yes, botanical. Yeah. For each we have.
Okay. Does Dr. Patel have a specific Ayurvedic doctor in the US he would recommend?
आप किसी यूएस में आयुर्वेदिक डॉक्टर को रिकमेंड कर सकते हैं? आप पहचानते हैं whom you think he is good?
नहीं, अभी तो मैं नहीं पहचानता हूँ. संपर्क में नहीं.
No, he doesn't.
कर सकते हैं, अगर आगे मालूम पड़ेगा तो आपको हम इन्फॉर्म कर सकते हैं.
Yes, he said if he finds he can let you know, but not at the moment.
Smita.
Yes.
For maybe for our patients here in the U.S.
Yeah.
Does he recommend, for a starting point, reading what does he feel about Dr. Vasant Lad's Ayurvedic book or Deepak Chopra's Perfect Health? Okay. I've read both of those and they're easy. It's like an easy concept to grasp.
Okay.
So
who is the first one you said?
I said Dr. Vasant Lad.
Okay, Vasant Lad.
Yeah. Mm-hmm.
Can you share that in the chat, Julie?
Yes, I will.
That would be great. Thank you.
I'll type it in right now.
Yeah.
I just wanted to validate, a little bit.
Yeah. Ashish, वो पूछ रहे हैं डॉक्टर वसंत लाड और डॉक्टर चोपड़ा, ये यूएस में उनकी आयुर्वेदिक बुक्स हैं, आपको उनका कोई उनके बारे में मालूम है? और वो सब ठीक है क्या, ऑथेंटिक पूछ रहे हैं वो?
मैंने अभी जनरली इस बुक को नहीं पढ़ा है, क्योंकि यहाँ पे इंडिया ही इतने राइटर हैं और यहाँ पे एंशिएंट जो बुक है उसी को मेनली पढ़ाया जाता है आयुर्वेद के लिए।
ओके,
5000 साल पुरानी है। हाँ, लेकिन मैं अब इनके बारे में पढ़ूंगा, उसके बाद इन्फॉर्म कर सकता हूँ कि वो प्रॉपर है कि नहीं।
Okay. He said normally in India they are taught the ancient books which are like 5,000 years ago. Those, you know, since then they are have been published. So he has not read in person of these two authors, but he said he will read it now and can check whether they are authentic or not.
Awesome, thank you.
Okay.
I have a question from Pinnakin. Dr. Patel, please advise and review, and there are 3 names that I do not know, Patanjali, Dabur, and Baidyanath. Yeah.
Oh, we can do that offline. I think that's a very good question to ask offline. And Pinnakin, you can send it to Smita and get it.
Dr. Patel, he's asking, what do you think about Patanjali, Dabur, and Baidyanath? Are they good as well?
जनरली तो सब ठीक है, लेकिन थोड़ा पतंजलि का तो ठीक है और वैद्यनाथ का उतना पसंद नहीं आता है, जनरली प्रैक्टिकली देखा गया।
Okay, and
my view.
अच्छा, ओके, क्या उसमें मिक्स ज्यादा है? क्यों ऐसा लगता है कि इतना इफेक्टिव नहीं है?
थोड़ा इफेक्टिव भी नहीं है, थोड़ा कम रहता है, और उसकी पैकिंग लोगों को लेने में भी थोड़ी परेशानी जाती है, उस तरीके से पैकिंग ना होना, और प्रॉपर रिजल्ट भी थोड़ा कम रहता है।
Okay, he's saying Patanjali and Dabur are okay. Baidyanath he's not sure because the packing is not good. It is difficult for patients to take it, so he doesn't recommend the Baidyanath products.
Okay, we have a question from Adam. Where's the best place to get these herbs? So I think if you want to order them from India or from the US. And the second part, yeah, please go.
Okay. वो पूछ रहे हैं कि कहाँ से हर्ब ऑर्डर कर सकते हैं इंडिया में?
इंडिया में जैसे मैम धूत ऑफिसर है कंपनी, उसका मेन हेडक्वार्टर मुंबई है।
अच्छा, ओके।
कोट्टाकल है उसका, तिरुवनंतपुरम केरल है। तो वो ऑनलाइन आप उस कंपनी की डिटेल से जानकारी ले सकते हैं, ऑनलाइन सब डिटेल पड़ा हुआ है, तो उसके हिसाब से आपको ऑर्डर का भी जानकारी दी जाएगी कैसे से आपको।
ओके, he says that the one company, the first one, what he suggested is based in Mumbai and the other one is based in Kerala, and you can directly contact online and order that from them.
Okay. I think we are.
I have one. Actually, I wanted to share a couple of things. Lisa Petsu actually just had something to share. She said she's finding, she's been to an Ayurvedic, someone who does Ayurvedic medicine, and she has found it very helpful. My question to everyone is, in the case studies, how many days a week were they treated? Did they do everything in a treatment center, or were some of the treatments given at home?
I think it was treated in treatment center only, because the patient went to the treatment center and every day they had some sort of treatment.
Right, so they would go to is that 7 days a week or 5 days a week, or? Did you ask him?
ये जो ट्रीटमेंट जो हमने केस रिपोर्ट्स देखी, उसमें दोनों केस रिपोर्ट में जो ट्रीटमेंट थे वो हर दिन ट्रीटमेंट हुआ कि 8 दिन छोड़ के थोड़ा गैप दे के हुआ?
नहीं, कंटिन्यू 55 डे, एंड वो स्टेप बाय स्टेप 4 स्टेज हैं, कंटिन्यू चला लगातार 55.
All right, so it was a continuous process, and every day there was some, because like there are 4 panchakarmas, so you have to follow each one of them. So yeah, it took just all 45 to 55 days in each case.
Right, and were they given some treatments to do at home as well, or did they just come to the center every day to get their treatments and go home?
No, every day to come to the center and then go home.
And
Also,
related, go ahead.
in India, there are centers where they would
IPD. Admitted in IPD.
In OPD.
IPD भी में एडमिट होके फिर कंटिन्यू ट्रीटमेंट चलता है.
ओके, तो फिर वो वहीं पर रहते थे क्या हॉस्पिटल में?
हाँ वहीं पे, हाँ हॉस्पिटल में 100 बेड हॉस्पिटल है.
Okay, so it is yeah, no, they used to stay in the hospital premises because it was a continuous treatment every day, so they stayed there.
And so, what kind of diet did they have while they were there?
वो कौन सी डाइट खाते थे जब ये ट्रीटमेंट लेते हैं?
जनरली आयुर्वेद में डाइट का एक्सप्लेन बहुत ज्यादा डिटेल में किया गया है. डिसीज बाय डिसीज ड्रग्स डाइट का भी बताया गया है. तो इसमें मेनली बात है वो वाले खाने में यूज करेंगे जो बात को ना बढ़ाए.
तो फॉर एग्जांपल
पचने में लाइट हो, जैसे कि मिल्क आप ले सकते हैं, उसमें हमने डिस्क्राइब किया है. ठीक है, इसमें खाने में गेहूं हुआ, राइस हुआ और सभी हरी सब्जी. उसमें मेनली खट्टे पदार्थ नहीं लेना है, अम्ल द्रव्य हुए जितने भी, और जो भी मिर्ची वाले मसाले वाले तीक्ष्ण द्रव्य है वो चीजें कुछ नहीं लेना है. जनरली वो लाइट डाइट रखना है. पानी प्रॉपर हल्का उष्ण पीना है, गर्म पानी पीना है. ये सब ध्यान रखते हैं.
He said the light diet should be taken throughout, so it should not be a spicy food. Number 2, it should not be sour, and it should be warm. So no cold food should be used. And milk can be taken, vegetables can be taken, rice, etc.
Right. And can you give an idea of how much that costs? I know in the States it's completely different, so he would not know about the UK or Europe or the States. But if they're in the hospital for 45 days in India, about how much does that cost?
Okay. इसका ये पूछ रहे हैं कि इसका यदि हम 45 डेज जो ट्रीटमेंट लेते तो उसका कॉस्ट कितना पड़ता है हॉस्पिटल में?
ये हॉस्पिटल में ये जो ट्रीटमेंट किया गया गवर्नमेंट हॉस्पिटल में किया गया. यहाँ पे गवर्नमेंट प्रोवाइड करती है, लेकिन ये पूरा ट्रीटमेंट आपका 25 से 30 हजार रुपए में. अगर आईपीडी चार्ज हॉस्पिटल प्राइवेट है तो उसमें जुड़ गया 50,000 टोटल हो सकता है.
250 pounds, which is he's saying that these two patients in the case report, they were treated in the government hospital, so the government paid for it. But normally if anyone goes privately, I think I can convert into pound, which is 250 pounds. Indian rupees is 25,000 rupees, and I think if you convert it into dollar, it's about $150.
Is that per day?
Oh, sorry, $400, not per day, as a total 45 days. 45 days treatment.
We'll check on that because that doesn't seem long enough. That wouldn't even cover the cost of food.
I mean, there were food, but the total cost of the medications and everything, that is what is like $400 approximately for the whole treatment.
For all the medication, right? But the treatments are what's expensive, right?
No. I think he's saying total cost is 25,000 rupees in Indian money, I think, which is equivalent to $400 for 45 days, the whole treatment. That's what it is. I don't know. We may have to check it again.
Yeah, we'll have to check that one again. All right.
Yeah.
So there were no indeed.
But it is a bit cheaper in India if people can. If here, like for example, we did go for last year an Ayurvedic treatment, and it costed about $2,000 for us.
Yeah. Oh, you did. How long did you go for?
We just went for 5 days, or 5 days, 5-6 days.
So we'll check the cost. Okay, thank you. The biggest issue with India actually is, I mean, there are a lot of really good Ayurvedic doctors throughout, in almost every country. So I think that's the way, especially the big issue with India is vaccines, because if you're coming from the West, you need to get vaccinated. And we know 2 people whose ALS was actually triggered by vaccines going to foreign countries. So you have to be really, really careful with any kind of vaccines when you have ALS, because literally they can get triggered by vaccines. ALS is one of the triggers for along with heavy metals and chemicals and a lot of other things, and stress, obviously.
There are some questions on these two patients. So were these two patients were just from literature, from Ayurvedic, or were they really patients of Dr. Patel? And the second question on that was, how many cases did Dr. Patel have where there was an improvement of ALS?
These two cases were not of Dr. Patel, because these were the case reports he has taken. And आपने treat किए Dr. Patel ALS के cases, and आपने improvement देखा है?
मैम मैंने करीब 3 केस को देखा है ALS के, वैसे और अदर न्यूरोलॉजिकल डिसीजों के केस देखे हैं.
Okay. And उनमें improvement आया था?
हाँ बिल्कुल improvement आया था.
And how much improvement दिखा तुम्हें, कितना दिखा improvement? I mean, क्या क्या चीजें improve हुई उनकी?
उसमें जनरली स्पास्टिसिटी जो दोनों लेग्स में थी उसमें इम्प्रूवमेंट आया, जो सिलरिंग स्पीच है उसमें अंतर आया, ग्रिपिंग, ये सब पावर में इंक्रीज हुआ. इन चीजों में सस्टिक्सालिपिन देने से इम्प्रूवमेंट आया. 5 से 6 स्कोर चेंजेस हुए उसमें.
Okay. He said he has done treatment on 3 patients, and they all showed improvement. There was improvement in speech, motor power, and और एक और क्या बोलता था आपने? And fasciculation. And spasticity.
Neuron.
Yes, and spasticity.
Okay. And does he know what happened with these two patients of the case reports, because they were from 2016, 2017?
Yeah.
Is there any information on what how it evolved after this reporting?
No. आपको मालूम है इन दोनों पेशेंट के आगे बाद में क्या हुआ?
हाँ, ये हमारे जो सीनियर्स हैं, उन्हीं के एक केस है. और वो
कैसे हैं वो दोनों?
मेरी बात हुई थी सर से, तो बोल रहे थे कि बढ़िया है और कुछ समय पे इनको फिर ट्रीटमेंट दिया जाता है. ये केस 2012 वाला था, वो अभी कंटिन्यू चल रहा है और हर 6 महीने में
करते हैं पूरा ट्रीटमेंट.
क्या सर मैम?
कितने दिन में रिपीट करते हैं पूरा ट्रीटमेंट?
करीब 6 मंथ पे एक बार सिटिंग रखते हैं ये पंचकर्म वाली, और साथ में ओरल मेडिसिन कुछ चलती रहती है.
Okay. He's saying that these two patients were from his senior colleagues, and they said they both are doing well, and they are on continuous oral medication, but the panchakarma treatment they get every 6 months.
Okay.
This is
great question. Adam asked about what is the best way to take these, but I think that was covered. There is no best way. There's a combination, and that's why you need an Ayurvedic doctor. We saw on the videos massage and oil. We saw dry massage. We saw enemas. We saw orally, and we saw steam. So there were 5 methods that we went over, and there is no best way. Those are the 5 we went over, unless I missed some.
Yeah. No, I think couple of methods definitely you can do at home. I think we did 3 methods, 3 or 4 methods we could do at home. Yeah, but obviously we need all the medicated oil and other things. So we have been discussing with Dr. Patel about it. And
so this is interesting because Vivek and Smita have just recently started Ayurvedic treatments. And so they're doing as much as they can at home, and they're working with Dr. Patel. So I think that's great, and he's sending them because they're both in the UK. Just to be clear about where everyone is.
I think we have only one question left here. It's a practical one. Do you have tea that you recommend for gut health?
कौन सी अच्छी चाय है gut health के लिए, Dr. Patel?
गट हेल्थ के लिए
चाय कौन सी अच्छी होती है वो पूछ रहे हैं.
मैम चाय तो अपन कोई भी यूज करें उसमें, लेकिन एक 3 हर्बल ड्रग का पाउडर है, उसको अगर मिलाया जाए उसमें,
वो कौन सा है नाम?
त्रिकटु नाम से आता है।
ओके, उसमें क्या
उसको
फायदा है?
उसमें जिंजर है और पिपली है, पाइपर लॉन्गम है एंड पाइपर नाइग्राम है।
ओके,
It increase immunity and peristaltic movement and digestion तीनों को।
अच्छा,
बट यहाँ पे कोविड के लिए भी यही ट्रीटमेंट पूरा आयुष विभाग कंटिन्यू दे रहा है, इम्यूनिटी बढ़ाने के लिए और जनरल हेल्थ मोटिवेट करने
ओके, एक मिनट में नाम लिख के देती हूँ। Dr. Patel is saying that you can use any tea, but you should add a special powder. I'll just write the name of the powder. क्या नाम है?
त्रिकटु
TRIKATU त्रिकटु powder. How much?
करीब 1 कप ऑफ टी के लिए 250 मिलीग्राम टू 500 मिलीग्राम बॉयल विथ टी।
How much?
250 mg.
250 mg. Okay.
2 to 500 mg. आधा ग्राम, पाव ग्राम।
Okay. So it's half a gram. 250.
250 mg.
But 250 milligrams, we know what that is,
Yeah.
right?
Yeah. 250 mg, because the powder it is 250 mg in a cup of tea.
To 500 mg.
250 mg to 500 mg.
In powder. Okay, thank you very much. We want to actually, we need to wrap it up because we're actually 7 minutes over. We usually try to finish at 90 minutes. So Dr. Patel, thank you so much. We really appreciate both Dr. Patels, actually. And thank you so much. And Smita, thank you very much for your translation and your extra, we could hear you a little bit better because they were breaking up a little bit. So that really was a big help. So thank you so much. So we're going to close our formal part of today. And Scott, I don't hear you for some reason.
I'm here.
Oh, good.
You can hear me now. And thank you both, Dr. Patel. Thank you, Smita. That was wonderful. It's a pack full of information. And sometimes time's tough to follow, but once we get the recordings up, we can actually play it back and slow it down, and it'll be able to help everyone, with all the graphics and the notes. Okay.
Yeah, and so what I noticed is just like the essential oils are given through the skin, and a lot of the vitamin and minerals can be given through the skin, the Ayurvedic medicine can also be very effective through the skin. So I think that's something to take home for everyone, that these things, sometimes if you have a gut issue, you're not absorbing things, and yet through enemas, medicated enemas, through suppositories, which we didn't cover today, but the suppositories are very similar. And there are other ways to take medication that's even from home.
Okay, yeah. Tish, can you do an unmute all in case someone had one
Absolutely.
or two quick urgent things that they want to verbalize, or any questions they had?
While
she's still here?
While she's
Actually, Julie, you have to unmute yourself real quick because I muted everyone, including you. So unmute yourself, and we'll go to Julie first.
I just wanted to add to a good place to start in the U.S. with Ayurveda is to check out, because I know it's a struggle to find a doctor with this being, a different, very ancient medicine, but check your yoga studios. A lot of times you can just do a Google search. There are many people that are not doctors, MDs per se in Ayurvedic medicine, but they're trained. I know Dr. Deepak Chopra has kind of an institution where he trains a lot of people in Ayurvedic medicine, and it's a good place where you could take a class. That's kind of what I did through one of the local yoga studios, and then through another yoga studio close to me, I found somebody that also did some of the oil processes. So maybe it's not so overwhelming for you to do those things that we just saw at home, that maybe you can just start there. So just a tip.
Yeah, and sometimes I found Chinese doctors and Ayurvedic medical doctors word of mouth. If you're looking for someone, a lot of times the people at the yoga studios know who the good local Ayurvedic doctors are, or even Ayurvedic practitioners. It does make a big difference. So as he said, the level of experience, and obviously Dr. Patel is at a very high level of both experience and education, and not everyone is, and yet, you know, sometimes we have to compromise because we can't find the best person, but we can also find a very good person, and herbs and things that are premixed that you can do at home.
The lady who was introducing them was a gynecologist, the other lady.
Oh.
And he is also a professor. I think he teaches Ayurvedic. Yeah.
Yeah.
Yes. So there obviously we have a very high level of expertise here on the call. But again, there are great doctors as far as going to someone specifically, but you can start these therapies at home. You know, depending on what your limitations are. So I think that's the idea, is you don't need to, you can kind of work your way up. Obviously, if you're in India, you can go to central India, which is they're about 3 hours from Bhopal. Is that correct?
Right, yeah.
Yeah, so everyone can unmute themselves and please share anything that you have to share.
Also share anything positive. If you had any gains in your functionality, please let us know. Keep us aware and keep us updated. Go right ahead.
Somebody is asking if Dr. Patel does he treat people like online over the phone and send medications? Is that something that's even a possibility?
Dr. Patel, can you unmute yourself, please? Are you able to do the online prescription and send the medications to the patient if somebody is asking you? Will you be able to do like a online? आप ऑनलाइन ट्रीटमेंट दे सकते और भेज सकते हैं किसी को जरूरत हो तो आपसे कैसे कांटेक्ट करेंगे
वो व्हाट्सएप नंबर दिया है और ईमेल आईडी दी है, अगर उसके थ्रू मैसेज करते हैं तो I will try to.
Yeah, he said he can do it and he has given his WhatsApp number and email ID, and I can share that again, and anyone can contact him.
Go right ahead. Is that Rob?
Yeah, that's
right. Rob. Go right ahead.
I discovered something in the last couple of months. A neurologist referred me to a small trial up at NIH testing the concept. Whoops, am I still okay?
Yeah, you're still there, Rob. Keep going.
You're still there, Rob.
Of a virus called HERV-K, HERV-K, and there's somebody up there at NIH that seems to have a theory that there's a connection, a close connection between motor neuron and ALS in particular with this virus. Every human seems to have it embedded in our DNA, but it seems to manifest itself in those of us with ALS, but not in people without ALS. So I just started a few days ago on a 4-drug antiviral cocktail that was used for HIV, and it's too early to tell if it'll do any good or not. But I just wanted to throw out, everyone, maybe in terms of leaving no stone unturned, should get a blood test for this HERV-K virus. I don't think it's the normal part of the protocol. I've been to Duke and Hopkins, and that wasn't something that they tested. But if you Google HERV-K, you'll see some case studies of people that had HIV that then began to develop ALS or ALS symptoms. And some of these viruses worked, especially if it was done early on. So I don't know if anybody else has heard about this, but there's a small public trial. They might have a few slots left. And even if you don't get on the trial, it's something to explore.
Thank you. That leads me to a question for Dr. Patel. Do you consider viral in Ayurvedic medicine? It seems that there's a viral component to ALS. There seems to be no doubt. So are you working with mostly the immune system, or are you specifically target any viruses in Ayurvedic medicine?
डॉक्टर पटेल वो पूछ रहे हैं कि आपके इसमें हम ट्रीटमेंट कोई वायरल ट्रीटमेंट भी करते हैं या फिर सीधे इम्यूनिटी पे ही ज्यादा फोकस करते हैं और वो ट्रीटमेंट करते हैं?
जनरली इम्यूनिटी के लिए तो है ही, लेकिन बहुत सारी स्टडी हुई मैडम एंटीवायरल वाली, चाहे हेपेटाइटिस के लिए हो, अभी कोविड में भी बहुत सा ट्रीटमेंट चल रहा है जो वायरस के लिए है, और तो उसमें कुछ भूमामल की है प्लांट, ये हिमालय की लिप 52 जो आती है, लीवर टॉनिक चलती है, ये वायरस पे भी काम करती है, वायरल लोड को भी कम करती है, तो ये इस पे भी स्टडी है। तो वायरस के लिए भी दवा है, हर्बल ड्रग वायरस को कम करती है, ऑल टाइप ऑफ वायरस, फ्लू के लिए है, सभी।
Okay. He said, yes, Ayurvedic medicine treats both the virus as well as the immune system. There are medications like hepatitis C virus. I mean, there are Ayurvedic medication like Liv 52, which is used for decreasing the viral load. So, yes, it is used for both.
Great. And Rob, thank you for sharing as well. That was a really good point. By the way, if anyone does not go to Everything ALS, it's every other Wednesday. It's everythingals.org. And so they are very traditional in a way, very conventional. And yet every time I go, I always learn a few things. So I think, it's just something that it's a very different approach to what we have. And yet I think they have a lot of great things to share. And as Irv K is one of them that I learned about on Everything ALS. So I go to their meetings also.
Thank you very much, Dr. Patel.
Thank you, Dr. Patel. It's probably 3 a.m. over there now. So
yes. Thank you for staying up.
Yes,
Thank
you, Smita.
Yeah.
Okay. Well, bye-bye, everybody.
Bye.
We'll see you all next Sunday. Okay, so bye-bye, Jimmy over there. I see you. Clara, Paul, Michael, Daphne, Karen, Cynthia, Sandy, Dorothea, Tondalea, Susan, Kevin. Bye-bye, Mary. And bye-bye. Bye-bye.
There's Tabitha. Bye, Tabitha. Bye, Denise.
Bye. Tabitha made it. All right.
Bye,
Bye-bye.
Steve.
Okay. Bye-bye, Michael Bear. We see you there, Michael. Thanks for joining. Okay. Bye-bye, Denise.
Bye.
Bye.
Bye, everyone.
You all. Bye, David. Thanks for being here, David.